There's what we call dose escalation. So dose escalation means that you start at a low dose, you check your side effects profile. If it is good, you go at a higher dose. If you keep losing weight, you go at a higher dose until you get to the summit. For Ozempic, for example, now most people will start at 0.5 or 0.25, and then you go to 1 milligram, for example. And since it's semaglutide, you can always switch between Ozempic and Wegovy. So typically, you go from maybe 0.5 to 1 milligram. You have a chat with your doctor, your physician after 4 weeks. If your side effect profile is okay, that means you don't have some side effects, you can go to 1.7. If your side effect profile is okay, not too bad, you can go to 2.4. If at any dose you have significant side effects, nauseous or vomiting, you have cramps, the next month either you stay at that dose or you go lower. So that's typically how a structured program would advise you. So yes, you start at a low dose, but you don't stay at the low dose. You keep going higher, so you get more weight loss and more benefits. And also because your body adapts to the drug quite easily, so you want to be on top of that and go to a higher dose. There are questions about the efficacy, questions about side effects, questions about the purity. There could be higher levels of impurities. And then you don't even know what to expect, because from one pen, you know that if you're giving one dose, you're getting 0.5. You injecting yourself just makes the whole process quite difficult. So we don't use it in our practice. We don't encourage it. Most standard practices don't use compounded drugs. So yeah, be wary about that. Thankfully, the data we have shows that there is no increased risk of cancer in humans. Yeah. So far so good. There's no increased risk of cancer. Nausea, which is the commonest, you have indigestion, bloating, heartburn, diarrhea, constipation. Thankfully, these are not too common. About 97% of people will not have side effects significant enough to warrant medical attention. And that is why you need to be in a structured program with a physician, so that if you have these issues, he knows how to step in. Some people might require drugs, some people might require antiemetics, that is anti-vomiting drugs or anti-nausea drugs. Some might require other medications if they have disturbing side effects. But most people do not have really significant side effects.